Hello friends, welcome to Medicine Hub 101. Today we'll go through the topic from it's one of the most important topic regarding pharmacology. That is the antihypertensive drugs. Okay. Now before going into details, let's understand a little view of these things. Okay. Now first of all, we need to know what is hypertension. Hypertension literally means what we know all know that hypertension means there is the high blood pressure. Okay. That literally means high blood pressure. Now, if you want to know what is blood pressure means what? Blood pressure means, let's suppose the blood is going through the blood vessels. Let's suppose that it's going through the blood vessels. Now, whenever the blood is going through the or passing through the blood vessels, at that time it will force, it will apply the force on the regions of the area of the blood vessels. From the formula from our from school, we know that what P equals to the force of a particular area. Now, whenever the blood is going through these regions, the blood is applying the force on the particular regions here. So, area we can also consider. So, we can say the P equals to F by A. Now, whenever the blood is going through this, blood vessel at that time, as the nature of the blood vessels, they are elastic in natures. So, they have elastic. That's why whenever the blood will go through, blood will go through within the blood vessel at that time, this blood vessels will stretch. That's why there will be no that much pressure. Okay, you try to understand it. Whenever the blood is passing through these regions, at the time it will stretch out. So there will be feeling no more that much pressure, normal pressure will be there. But let's suppose for any regions, if the elastic bodies or elastic, all the things are just get destroyed. So then what will happen? If these things are not there, there is not existence of these things at that time, there will be what is stiffness, or you can say the term is very important, the stiffness. It will act like the stiffness, or that will be more. Okay. Now to understand it, let's just have the another concept regarding it, how the stiffness is increasing. Okay. I just said for it on the region, the other regions are here. Then let's suppose okay. Now it will be thickened. I am talking about the thickness. Okay. It will be thickened. How it will be thickened? This thickened is totally dependent upon one of the also most important thing, that is the serum sodium level. The serum sodium level that's proportional to the hardness. You can also that will be too much hardening. Okay, hardness of the blood vessels. Now the serum sodium level that will is totally proportional to the hardness of the blood vessels. Okay. Another thing. Now if you can reduce the serum sodium level, okay. But another thing, whenever there is high blood pressure or hypertension, at the time obviously the blood volume that will be also more. The blood volume that will be also definitely more. Now if you can reduce the serum sodium level, along with the blood volume, I mean the water. Okay, if you can reduce these two things, then you can treat the patients. At the time the hardness will be less, at the time the blood pressure definitely will be less. Along with if you can reduce the amount of the water molecules, or you can reduce the volume, then there will be also the less pressure. Now, these two type of the things, like the reducing of the sodium along with the water, this is done by one type of the group of drugs that is called the diuretics. Okay, that is called diuretics. These diuretics will help to remove the sodium along with water molecules from the body. Okay, now we'll talk about a little bit about diuretics. Then we'll go through the other type of the drugs, or the other class of the drugs which also help in the hypertension. Okay. Hope you understood that what is diuretics. Now let's suppose the diuretics is here. Basically it's two types. One is that is the loop diuretics. I am writing briefly. D stands for diuretics. Another is thiazide. Okay. Now see, loop diuretics, this act for very short time. Short acting, but it will like strong. Okay, but it will reduce the volume. The amount that will reduce, be reduced by acting of this drug, that is very much. Okay, like the more. more amount of the blood volume that will be reduced instantly within the very short time. But here in case of thiazide, that is not that much strong, that is weak diuretics, or you can say also the long term, that will act for long term acting. That will also reduce the blood volume, but very gradually. It will just gradually, but it will reduce the volume very fast. But it will also remove the what? It will also remove the blood volume, but it will remove the blood volume gradually. But it will, that means it will take time. That's why it is the name of this type of the diuretics, long term acting. Okay. Now other type of the group of drugs, what are the usefulness, or we can say those are also useful in case of the hypertension. Now let's have a recap on them. Now we can also say the other first type of the drugs. So I just said, I made the mention, that is the diuretics. And another group of the drugs that is also very useful, that is the vasodilators. I will talk about these things all in details. Vasodilator. Then we are having also sympathetic ganglia blocker, or blocking of blockage of the. There are some group of the drugs which will block the sympathetic ganglia system. Okay, and the last and most important also, the blocking of the RAAS system. This stands for renin angiotensin aldosterone system. I am repeating again, renin angiotensin aldosterone system blockers. Okay. Now we'll go through all the things step by step. We already talked about the diuretics. We'll have a totally other separate lecture for the diuretics, where we will talk about all the things, the type of the diuretics, okay, and the mechanisms, all the things. Okay. Now I'm going through the vasodilators. Okay. Now if we talk about the vasodilators, vasodilator. Now we all know that in our body one substance, that is the nitric oxide, that is also secreted by the endothelial cells. Let's suppose it's the endothelial cells. It's not the proper diagram, just phrase. Okay. Now they can release on substance, that is nitric oxide, that acts as a vasodilator. Okay, that's the function of the NO, is to cause the vasodilations. Okay. Now there are certain type of the drugs which can also release the nitric oxide, that will also act as the vasodilators here. Okay. Now we have to know what is the mechanism of the vasodilator first. First, see, whenever the NO is released, first let's suppose that NOA has been released from the drugs. Okay. Now whenever this NO will be released, that will activate the one of the enzyme that is called the guanonyl cyclase. Guanonyl cyclase. I am writing briefly GC. That means it will activate the enzyme that is called guanonyl cyclase. Now the function of the guanonyl cyclase, like the adenyl cyclase we already talked about. Okay, that will convert the ATP into cyclic GMP. That will activate the ATP into cyclic. C stands for cyclic, GMP guanosine monophosphate. Cyclic GMP stands for guanosine monophosphate. Now this cyclic guanosine monophosphate, that will activate the phosphokinase Z. Okay, the also enzymes like these things, they actually act like this. Okay. Now this phosphokinase G will inhibit. Now this phosphokinase G, that will inhibit the function of MLCK. Now what is MLCK? MLCK stands for myosin light chain kinase. I'm writing here. Myosin light chain kinase. Now whenever this enzyme will be inhibited by the action of PKG, and this PKG will be activated by the action of the cyclic GMP, at that time this will lead to smooth muscle relaxation. Okay, and whenever we'll see there is like the smooth muscle relaxation at the time, basically there will be what vasodilation that will lead to ultimate the thing that we desire for, that is the vasodilation. And whenever this vasodilation will be there, ultimately we can say from here easily the blood pressure that will be reduced. So that is also useful for the patients in case of what, the hypertensions. Okay. Hope you understood these mechanisms. Now, which type of the drugs they can release? We need to know the name of the drugs which can release the NO here. Okay. Now we need to know the drugs which releases the NO. The drugs like sodium nitroprusside. I am writing N stands for sodium nitroprusside. Okay. Another type of the drugs you can also use like the hydralazine. Now, actually these two type of the drugs they are used in emergency. Okay, that's why these two type of the drugs are called emergency. Okay, hypertensive emergency. Emergency. Okay, these two type of the drugs can be used in emergency. Now the main problem with the drug that is here, the main problem with this is sodium nitroprusside. If any persons or if any patients they are just taking the sodium nitroprusside for long time, for long period, then it will cause the cyanide poisoning. Okay, that will lead to the cyanide poisoning. Cyanide poisoning. Now to treat the cyanide poisoning, we need to use another type of the drugs. Okay. Now we can also say that antidote of it. That means cyanide poisoning. That is antidote. This one. Hydroxycolamine. Like the vitamin B2, no? And whenever the cyanide will act with this thing, that will form the cyanocobalamin. Cyanocobalamin. And whenever this cyanocobalamin will be this, that can be easily, excreted out through the kidney. It will be excreted out. That will be the water soluble. So now this is the thing, okay? So this type of the drugs they have releases what I just said that they will release the nitric oxide. This two type of the drugs they are used in case of the emergency. Okay. Now other types of the drugs we can also use for vasodilations. Other group of the drugs that we can use also in case of vasodilation like that. We can also use the L-type calcium channel blocker. L-type calcium channel blockers. The same, almost like the same mechanisms I just said, like the in case of that will also release the like the. But in case of the calcium, that will, we all know that in case of the muscular contraction, you need the calcium, and if you just block the calcium, there will be no contraction. As a result, we can also see the relaxations. It's brief terms we can also see like this. But the L-type calcium channel blockers, we can also use the drugs like the verapamil. We can also use the diltiazem. We can also use two type of the drugs. Okay. Now another type of the drugs we can use that is also useful in case of like the potassium channel openers. We can also use the potassium channel